Hi, I'm Dr. Samuel Ho. I'm a plastic surgeon at Allure Plastic Surgery.
Hi, my name is Clarissa and I'm here at Allure Plastic Surgery.
A fat grafting procedure is simply transferring fat from an unwanted location in your body to another place where you want it. I'll give you an example. You can transfer fat from your love handles to the face. During a fat grafting procedure, what we do is we must first have a harvest portion where we take fat from an unwanted region. This can be from the thighs, the tummy, the love handles, and then the fat is purified and removed of things that we do not want. This can consist of blood, plasma, white blood cells, all the other things that we don't want. We just want the pure fat component, and after the fat has been purified, we then do the transfer procedure. The fat is then transferred to a location that you want, such as the face, the breast, or the buttocks. I'm often asked this question, but the straight answer is no. Your body will recognize somebody else's fat as foreign and it will be rejected. Fat grafting can be thought of like a natural filler, but the advantage is that one, you can remove fat from an area that you do not want it in. Second, it tends to be a lot more long-lasting than fillers because these are live cells, and once they've taken on a blood supply in the new location, they will essentially be alive and be maintained over years rather than months that is the case for fillers. Yes, you will lose volume during weight loss if it's significant. Significant being about anywhere 6 to 10% of your baseline body weight. This is because as you lose weight, you will lose fat in other places of the body, including the fat grafted region. However, if you do put on the weight, the volume will come back because the fat cells are live and they are actually maintained in the grafted area. So the fat cells do not die off as you lose weight. What is lost is actually the volume or the fat store. I often get told that fat grafting is not long-lasting by some of my patients who have undergone fat grafting elsewhere before. I feel that this is down to two things. One is the amount of fat graft that was transferred may have been less than needed, and therefore they feel that the result after 2 or 3 months is less than ideal. And this is really because you have to cater for a certain degree of fat loss due to the stress of the procedure. The second reason I feel is that they were not adequately counseled on the recovery process after a fat grafting. One needs to be very careful about your diet as well as the exercise that you undergo in the first 6 weeks after the procedure.
I'm really petite and it is very difficult for me to gain weight. My face tends to be a little bit more sunken and I want to add more fats and volume to my face, making it more youthful and Korean looking. I actually did full face fat grafting 1.5 years ago, but the volume on my forehead has gone down. This time round, I'm only gonna add volume to my forehead. As you can see, I can still add a bit more volume to my forehead and temples. Come follow my journey.
That's a good question, and it boils down to how much fat is transferred and where the fat is transferred to. You basically want a face that's more three-dimensional, more projected, not a face that's fatter and wider. So where we transfer the fat to is very important. Typically, these will be areas in the central part of the face. We do not usually want to transfer fat to areas at the side of the face because this will definitely make you look fatter. The amount of fat transferred is also very important. You do not want to over or under transfer fat because over transferring fat obviously will make the face look fatter, but under transferring fat will result in an outcome that is less than desired. So the recovery, you will expect two things: bruising and swelling. Bruising, if you do encounter it, will be mild and will be resolved in about 7 to 10 days at most. But more commonly, you will get more swelling, and the swelling is because of the surgical swelling as well as the swelling that occurs because more fat than needed is transferred. This is because not all the fat cells that are transferred will survive the process. Typically, only about 40 to 60% of fat will survive the transfer process. Therefore, I will usually transfer a little bit more than required to account for this so that we can get a good result at the end.